how long have we known about acoustic neuromas?
That's a great question. How long have we known about acoustic neuromas? In retrospect, if you look at the historical medical literature, acoustic neuromas have been known for a number of centuries. If we go back 300 or 400 years, there are reports of patients that over time developed hearing loss and ringing in the ears, and then over the course of the next several years developed balance problems. So in hindsight, now using what we know at the present, these patients had acoustic neuromas, but we did not have the imaging technology that allowed us to obtain pictures. CT scans have only been around since the 1970s and MRI scans since the 1980s. So prior to that time, it was very difficult to make the diagnosis of acoustic neuromas. The patients historically before imaging that presented with acoustic neuromas did present with hearing loss and balance disorders. And the first descriptions of acoustic neuromas were actually based on autopsy results in these patients, in which a tumor was located at the back of the head at the base of the skull. And when studies were done on these autopsies, these tumors were shown to be growing off of the hearing nerves, and they looked like small, round, grape-sized tumors or walnut-sized tumors as they became larger. The first surgery for acoustic neuroma was done actually over 100 years ago, and obviously we didn't have the same type of technology that we have these days using microscopes and microscopic instruments and special neurophysiologic monitoring, which is the monitoring of the brain activities during the surgery. And so, as one would expect, the first surgeries for acoustic neuromas done over a century ago had poor outcomes because we didn't really understand the type of tumor and the anatomy. Because most acoustic neuromas presented with hearing loss as the main symptoms, it was thought for many decades that the hearing nerve was the source of the tumors. We know that the hearing nerve is part of cranial nerve 8. There are a total of 12 nerves that emerge from each side of the brain, and cranial nerve 8 is in part the hearing nerve. But we now know that these acoustic neuromas, or the properly called vestibular schwannomas, grow off the balance nerve, which is also part of cranial nerve 8. So we know that cranial nerve 8 has multiple functions. And as these tumors enlarge, they compress the hearing nerve and the balance nerve, which is why patients get those types of disorders.